may need a longer time to get to a real level of fitness. Whatever rehab that we tell them to do must be more controlled. I do remember a patient who was referred to us from a big rehab center. He was Cat 5, he was intubated, and it was really frustrating for him to have these symptoms. And yes, his lungs were the main issue or the main problem. The heart was all right, but he kept getting very high heart rate and symptoms with mild exertion. And even after a few weeks of the medications that stabilize his heart rate, he's already recovered, and I think these patients will hopefully get well. Up to what level, we don't know. We're still learning with COVID how much recovery does occur to the heart. Is it the same with all the other infections that we've seen previously, like a bad case of influenza? How much recovery happens to the lungs? So I think we're still learning. We've only had a good 1.5 years of ill patients in Malaysia with COVID.
Yeah. And how about those who complain of slow heart rate? We've now got almost a lot of people have got pulse oximeter. They put it on their finger. Some even have those watch with Garmin watch or Fitbit or Apple Watch and shows their heart rate. How about those with low heart rate? They come to me complaining, "Doctor, my heart rate is 40.
I mean, your group of patients may be the same age as you, so they may be healthy.
We are almost the same age, okay?
so there may be people who were healthy before the COVID, and unfortunately they had the infection, and only now when they've got a machine or they've got a saturation monitor that they've seen what the heart rate looks like. But most of the time with heart disease, it's when the heart rate is high that we get a bit worried. If the heart is really low and they have symptoms, they're falling over, they're feeling really giddy when they get up from the toilet or when they get up from the prayers, they feel that they want to faint. Those are the patients where you have to be alert of, and then you do an ECG. And if the ECG is just something called sinus bradycardia, which just means a low heart rate, then normally it should be all right. Unless you have distinct patterns, AV blocks and stuff. Those are the things that we need.
I think it's important to see if the heart rate goes up with activity. They're just sitting down, lying down. Yes, the heart rate may be slower. It may not be COVID related. There are, like you say, our age who are really fit. They cycle 100 kilometers on the weekend, 200 kilometers on the weekend. Their heart rate could be in the mid 40s. Can even go down to 38 sometimes. And only recently they bought all this pulse oximeter. They look at their own heart rate and they notice, oh no, my heart rate is slow. But they do not have any symptoms with it. If they exercise or exert themselves, even going upstairs, the heart rate goes up normally, isn't it?
Yeah, so that's a good point. So see what happens to their heart rate when they are doing usual physical activity. Yeah, good point.
And another thing, those with COVID, again, we've had a few who had severe COVID. After they've recovered, they come to see us. Their heart muscles are a bit weak. So ejection fraction, or how much the heart pumps, normally is above 50%. Theirs could be 30%. Some part of the heart isn't moving, but after a few weeks or even months, they seem to recover very well, don't they?
Yeah, this is the thing about any kind of insult to the heart, and it may be a large insult, like a huge heart attack. As long as the patient survives that event, or it's a bad case of COVID, we do see that the heart does regenerate, and the function will improve with time and good medication. And we know that, when you see the heart, it's not just those 3-4 big vessels which are supplying the heart. It's millions and millions of smaller vessels which has got a larger surface area, and those are the things which will really try its best to just compensate. And with time, especially if there is something which is reversible, like an infection, reversible like making sure that the blood pressure is okay during that acute event, hopefully the heart will recover. And with time, even at home, exercise, rehab, we do have important data on post-COVID rehab for the lungs and for the heart. That's quite promising.
We've got another question here, Dr. Zubin, from a Dr. Harvey Gunn. It says, although self-quarantine for COVID category 1 and 2 is the current norm, but there are also concerned because the cases of BID, which is brought in death, is going up. Any comment on that?
I mean, that's a tough one. I think at one stage we were seeing this a bit more, maybe for those who were stationed in the emergency departments around the hospitals. It's something which I don't think two cardiologists can answer here, but the numbers were really high and they were finding it really difficult to get these patients in hospital. And it's unfortunate that with COVID it will still attack people who may be young, and things like abnormal heart rhythms, thrombosis or blood clots, and these are things which may have caused. And a lot of patients, even those who don't have COVID, it's essentially something like sudden death can happen in some who's late 30s, early 40s, and these are patients who may go through life in early stage where they don't know that they have heart disease. It's a tough one. Yes, it's certainly a concern. I don't know what the rates of BID is now in the last 2 weeks. It seems to be better. Really have to make sure that the vaccination is complete. I can't talk too much about giving a booster like some countries in Europe, but we really have to be ready for extra doses, I think, for vaccines. But it's way out of my kind of thoughts now, I think. Mm-hmm. Thanks for the question, Dr. Harvey Gunn. I think it's important. Something big should see this.
Yeah. And how about, a few months ago, unfortunately, we had one of our beloved nurses who worked with us in cardiac rehab in another center, unfortunately passed away. She had COVID while she was pregnant. Again, it's difficult, isn't it? With pregnancy, you do get some fatigue, tiredness, you do get palpitations. It's difficult to find out whether it's because of the heart or is it changes from pregnancy itself, isn't it?
Yeah, it is hard, and we know these patients are, they may be pregnant and they may already be in the age where you kind of expect further symptoms of tiredness and dyspnea with having a large situation like that. But I think even early on there was a bit of question marks regarding when you're pregnant, when is it safe for us to get vaccinated. Guidelines kind of change early on, and then we are asked to make sure all our pregnant staff were vaccinated. I think as all we see, there were some hesitancy at the start, but we know even without COVID, when we are pregnant, the risk of blood clots either in the veins or in the arteries is increased, and what more now that we know that it is increased with COVID. So it's unfortunate, and anybody out there who has got questions regarding pregnancy, I think the best is to ask maybe the ONG specialists, your own doctors. But it's clear that there are some increased risk of blood clots, and if there is any infection with COVID, these patients may need to be admitted earlier for observations, even though they are only in the stage category 2, example. Maybe not.
Well, we've got another question here regarding type 2 heart attacks possible after getting infected with COVID. Well, there are many types of heart attacks. The ones that we usually treat, or the ones that we usually hear of, are what we call the type 1s, where there's a cholesterol or plaque that ruptured and it causes blockages or blockade of the heart vessel. But type 2 heart attack is a type of heart attack where the heart is so stressed because of what's happening to the body that the heart just fatigued, isn't it?
Yeah. So we've seen this a lot, and the evidence is there when we see our patients who have severe COVID, Cat 4, Cat 5, and they need oxygen because their lungs are full of gunk, which does not help the transfer of oxygen, and the stress on the heart, especially if it's a diseased heart, maybe previous heart failure, elderly person with her vessels might not be blocked, but the intense stress that the heart has to go through will cause some damage, or it's both damage plus say mismatch between what the heart needs for its nutrients, which includes oxygen and the blood, and what the heart itself can get. So there's a whole range of mechanisms involved in type 2 MI, but infection is one of them, severe hypoxia is one of them, and stress to the heart is one of them. Yes, so we do see this, and it's something which needs to be recognized.
Yeah, I think the 3 cases that we had, they had recovered from COVID, and they were feeling well in themselves. But if I've done some reading about it, it's about all the systemic inflammation. Even if the COVID infection or the COVID virus itself has gone away from the body, but the inflammation still could persist in the body after that, isn't it? So that's what causing these type 2 heart attacks. We have another question. I think we've talked about it a bit. Is heart damage after caused by COVID-19 permanent? We've addressed it a bit just now, because the heart muscle is something resilient, isn't it? Given time, it may recover. It usually recovers actually, given time, and with medication, rehabilitation, it usually recovers quite well, isn't it?
Yeah. So that's a baseline. That's a baseline answer for this kind of situation with any scar tissue. And yes, the heart organ is a huge muscle which is resilient and has got the reserves that we can see time again to go through something like a severe COVID infection. I don't think we know how many patients who get scar tissue, how many of them. But I think the thing is with scar tissue is you may get scar tissue, but somehow the other areas around that scar tissue will help out. So you may not have any symptoms at all. Your heart functions is like normal. You may be able to go back to your normal self, maybe even healthier because you've done more exercise. But the small area of scar tissue is still there. So this is what is quite amazing with the heart, because the other areas of the heart may be able to compensate, and it's not just not the numbers and not just what you see on MRI scan, but it's what actually you can do with that the remainder of the heart tissue. But yes, you do need to see your physician. It may be your own GP, maybe your own physician. If there's something else which your physicians or GP will have some questions, then you may be referred to your cardiologist for the monitoring.
Yeah. Good advice. We've got another question from Dr. Kashmahinder Singh. Question a bit difficult. What are your comments about vaccination doses warning, which is being suggested as being the cause for the recent increase in cases in Sarawak? If true, third doses seem to be a likelihood. I think that's something difficult to. I do not know, and unfortunately, I don't know. Do you know?
I think I will rely on my colleagues who are involved in vaccines and the ID specialists, and I think whatever advice we see from WHO and the CDC is the advice that we will get and we will transmit to Ministry of Health. That's a tough one. I hope we get the answer soon. I hope we all get the answer, and I don't think we can answer that. Thanks for the question.
Yep. Got another one here from Melissa Parabakaran di Costa. If one has benign PVCs, will increase the risk to have cardiac issues if contracted COVID. First of all, PVCs are premature ventricular contraction, meaning the heart, someone may miss a beat or they get extra beats. It's usually benign, but some causes could be because of ischemic heart disease. In the young, it could be a lot of causes, particularly your hypertrophic cardiomyopathy, where the heart is a bit enlarged, the heart is a bit thick. It could be arrhythmogenic ventricular cardiomyopathy, where the fibers that carries electric in the heart is a bit wonky, isn't it? That's the best word to describe it. But PVCs in itself is usually benign. But the question here is a good question. If someone has benign PVCs, will it increase the risk to have cardiac issues if they get COVID?
I think looking at maybe the person who's asking the question is probably young and she's in Facebook, so maybe that generation. So I would believe that young and healthy and without any structural heart disease, I would think that there is certainly a risk of those PVCs maybe getting a bit more frequent just during that time. Whether or not there's anything new for the patient with just PVCs, things like thrombosis or blood clots, there's no, at this stage, there's no evidence that only that makes the person at a high risk of these complications. Those with complications is severe COVID, those who are elderly, and I think at this stage, those who are obese somehow, and maybe multiple kind of other medical problems like kidney disease and diabetes. But if it's just pure PVCs, I think that it not make sense, but I think I do feel that you may be at an extra risk of getting a bit more PVCs during that time.
Yes.
Even a fever might cause that.
Yes.
And not sleeping for the whole night can cause extra PVCs, for example. So even simple things like that can cause for the increase. Otherwise, do you think there's anything more that this person should be concerned about?
No, PVCs, like I said, are usually benign. They get misbeats. Some do get these PVCs when they eat a lot more salt, when they get PVCs. But the advice is to get it checked. Again, like Dr. Zubin said, we have the facilities to monitor your heart rate. We can go from 1 day all the way to 2 weeks. But if you do have concerns, just come and have a chat with us. Next question. From Mel Sidu. Another difficult question. Are we doing enough for our category 3 patients? I think we are doing the best that we can. I've seen my colleagues working day and night treating these patients. Sometimes they forget about themselves while they look after this patient, don't they?
I think shout out to, I think that's what young people say now, shout out to my colleagues who are in the emergency department, in the ICUs, and then they work hard. Not just the doctors, obviously, but certainly the nurses or the allied health staff. I think all countries which are involved in the care of COVID, I think all countries are doing what they can at best with the resources that we have. So I think that's what we can do. Yes, there will be some discussion within our own community, and for us to be critical of what we can do. I think that's the best thing that is for not for the future, but hopefully if something like this happens again. And this COVID might, it seems to be getting better. Let's hope it does, but we may be seeing something else more later on. We don't know. So I think we should ask this question to ourselves. But I
I think we're still learning about this COVID, isn't it? Every day
yeah.
there are new things that come out. I think we're still learning. Treatment for COVID, there are many, and a lot are still being researched, isn't it? One last question, Dr. Zubin. Advice for those who have recovered from COVID, they're at home now. What advice should we give them?
I think one is, I think you still need to be vaccinated, and that's one. Hopefully, there will be a time when you will be able to get some form of rehab when you and if you need it, either simple cardiac rehab or rehab to your lungs. There are patients who have been quite sick and they need follow up with how the muscles have worked, the limbs. Those who have been ventilated, for example, they might be weak. I hope you get some advice on nutrition, for example. But if there are any kind of questions that you have, I think the first place of contact will be the doctors who were looking after you in the previous hospitals. Your usual physicians or your GPs will be the point of contact too. And if there's any specific concerns about lungs, heart, and other organs, then you may or not, hopefully you will be referred to a place where we are able to look after you.
Oh, got another question here. Sorry, I thought that was the last question. Sorry. The question, Dr. Harvey Gunn. Can stress cause heart discomfort? I always get that question. I always tell my patient, in life we do need a bit of stress, because then we won't get out of our chairs or out of our sofas. But I guess too much stress does cause problem, because when you're stressed, you eat erratically, you snack a lot more, probably don't go out exercising, isn't it?
I think I'll answer that first thing. Stress can cause a whole range of symptoms from top to bottom. So headaches, chest pains, breathing problems, stomach aches, joint problems, muscle aches. So stress can cause real physical problems, physical symptoms, and they are real for that patient. And we've been taught of this since kind of medical school. So yes, stress can cause that. Yeah. And yes, we do know that for those people who have not got COVID, even the stress of hanging around in their rooms, at home, we don't know what's happening with COVID. Their kids are at school, at home. So there's a whole range of things for everybody now to have stress. And yes, I think we do need people who listen, doctors who can listen to make sure that when we've done the usual kind of chat about the symptoms, think about stress, think about what the whole issue with this COVID pandemic can cause, and hopefully all the tests are normal, and maybe a simple referral to I mean, not directly a referral to say psychiatrists, but just by acknowledging that it may be stress will help. Looking at your results as being normal will help, and if the patient is keen enough to speak to a counselor or psychologist, psychiatrist, that could further help.
All right, awesome, cool. Another question. Do heart patients really have a higher chance of getting COVID? Is this only experienced by heart patients or other people?
I think we're happy to say that just by being a heart patient, you are not at increased risk of getting COVID.
Yeah. I think it's the complication from COVID that we are worried about, isn't it?
Yep. Yeah. And that's been shown in few large studies around the world. That's quite clear.
Yeah. Another question. As I know from Mr. Harvey Gunn, thank you very much for the question. As I know, some private hospital may not take in category 4 and 5 COVID. Do ARA take in?
Yeah, I think we've had Cat 4 and 5s in the last few months, and if these patients land on our emergency department, I think at one stage, all the hospitals around Klang Valley were full with patients, and they had to be admitted here. And we've had at least 6 or 8 very ill Cat 5 patients. Yeah, so yes.
Okay then, thank you very much everyone. That has been a really educational and entertaining talk with Dr. Zubin. Thank you very much, Dr. Zubin. Again, if anyone has any concerns about their heart, please come to visit us at Damansara Medical Center. Before I end, I have a pantun from my uncle all the way from Melaka. 2-3 kucing berlari-lari atas peti. Gejala COVID mesti dihindari. Jantung sihat, jagalah diri.
Thank you, Rizmy. Thanks.
Thank you very much, everyone. Alright, and we'll wrap it up here. Bye.
Goodbye.